We're joined now by Dr. Chad Muxlow. He is an orthopedic sports medicine surgeon with Centera RMH Orthopedics and Sports Medicine. And first of all, what specific sports medicine services do you all offer?
We provide comprehensive sports medicine services, including any injuries from simple strains and sprains to complex ligament reconstructions and everything in between.
Okay. Now, what type of age groups, typical ages of patients that are seen in sports medicine?
We see a wide range of patients in sports medicine, offer them services anywhere from pediatric patients ages 6 up to patients in their 80s that have shoulder problems.
Really? Okay, so what are the most common injuries that are seen?
I would say the more common injuries are ligament injuries in the knee and meniscal injuries, including meniscus tears. In the shoulder, I would say rotator cuff injuries are the more common injuries we've seen, and they're generally in patients 50s to 60s and older.
Okay, so obviously we hear a lot about knee injuries in athletes. When you're talking about 50, 60 years and older, people that are having rotator cuff, that's shoulder problems, how are they happening? Why are they happening?
Sure.
And what are the symptoms?
Well, a lot of times these injuries, especially rotator cuff injuries, are actually more of a wear and tear type of injury that occur over time, not necessarily from a sport injury per se. So a lot of times people, just with wear and tear, if they've had heavy lifting jobs with their shoulders, overhead activities, repetitive activities, tend to develop issues with their rotator cuff. And a lot of symptoms they have is difficulty with lifting their arms above their head, being able to reach their head, putting dishes up into the shelves, and simple activities such as brushing your hair and brushing your teeth, causing pain in the shoulder.
So this shouldn't just be minimized by someone in their 50s and 60s and they say, oh, I'm just getting old, I don't have as much motion as I used to. There's a fixable problem?
Absolutely. So things as simple as physical therapy and cortisone injections sometimes are able to take care of the pain and restore some function. And when that doesn't work, then we offer surgical intervention for repair of the rotator cuff, which is repairing the tendon back to its attachment site. We see these in patients in their 60s, 50s, even patients in their 80s. So just because you're getting older in age doesn't necessarily mean that you're stuck with a shoulder that does not function like you would like it to.
So when you do the surgery, like for a shoulder, you will, reattach a tendon that has become unattached?
Absolutely. That's what a tear actually is for the rotator cuff. It's not a tear as in if you rip a piece of paper. It's actually a detachment from the bone itself. And so what I do is arthroscopically, through little poke hole incisions and use of a video camera, go back in and reattach that tendon to the bone.
And what makes it stay?
Well, we use little devices. They're called anchors. They're little calcium screws, essentially, that have sutures coming out of them. These calcium screws absorb into bone over time. We pass the sutures up through the tendon and use that to hold the tendon back into place until the body heals it back down.
Interesting. Now, what services are provided overall by Centera RMH Orthopedics and Sports Medicine?
Well, we provide a wide range of services, including joint replacement services for the knees, hip, and shoulder, also spine services, and general orthopedic and fracture care as well. So
pretty much any type of orthopedic problem that people are experiencing, they can go to RMH Orthopedics and Sports Medicine and get it taken care of.
Absolutely.
All right. Well, Dr. Chad Muxlow, an orthopedic sports medicine surgeon with Centera RMH Orthopedics and Sports Medicine, thanks so much for being with us.
Absolutely. Thank you.